Diabetes was always in the back of my head that I could get it, but you are never ever prepared for a life-changing diagnosis like that.
It was just almost too much to handle, so I kind of blur out that week.
It's a whole change of your life.
As you just heard, diabetes is a complex disease, and living with it every day can be difficult.
Diabetes educators, like myself and Cecilia, have created this series, Managing Your Diabetes.
This series has 7 short videos and some helpful informational sheets that you can download in either English or Spanish. We give you tips for making life easier as you learn to live with diabetes.
Each video focuses on a different topic: healthy eating, being active, monitoring, taking medication, problem solving, reducing risks, and healthy coping.
Each program runs for only 4 to 6 minutes, so they won't take hours of your time to watch. And there's no particular order, so you can watch any part at any time, even rewatch some if you like, whatever your schedule allows.
We do suggest that you watch the entire series. It has some great suggestions for helping you take control of your diabetes.
If you want your numbers to be good and you want to live longer, it's something that you have to change in your lifestyle.
One of the best ways I found to cope with my disease is to educate myself about my disease. The more you know, the more power you have over it.
Managing Your Diabetes: 7 Steps to a Healthier You. You've got diabetes, so your favorite meals just went down the drain, right? Wrong. With diabetes, you do have to be more careful about what you eat, but nothing's off the table, including dining at your favorite restaurant. What you need to know is that the foods you eat affect your blood sugar or blood glucose, so you need to keep track of what you eat and how much.
It's a matter of being more aware of the portion sizes you eat to help you manage your diabetes and prevent other health problems.
Eventually you accept it as you just change your life and change your lifestyle.
Dan Diliberti has been learning to live with diabetes for 20 years now. Reading food labels and measuring portions have become second nature to both him and his wife, Ann.
My wife's very supportive. She's very much into diet and nutrition, so we're just more aware of what we're eating and how we're eating.
Dan admits it's not always easy, especially when it comes to traveling or going to parties.
I tend to slip sometimes on those occasions, and I come back and pay the price in terms of having to run a couple miles or my treadmill or get the sugar levels down. And sometimes I just have to grin and bear it. I made a mistake, and I'll do better next time and forgive myself and move on.
Dan is extra careful when he gets sick or if he's under a lot of stress, because stress increases blood sugar levels.
When I'm undergoing a stressful situation, I just have to watch what I'm eating more carefully, because it seems like it gets converted to sugar no matter what I eat.
For anyone with diabetes, a healthy meal plan should be balanced with carbohydrates, fiber, protein, lots of non-starchy vegetables, and limited amounts of heart-healthy fats. Recommended carbohydrates include whole grain bread, oatmeal, potatoes, and brown or wild rice. Fiber could come from beans, whole grains, fruits, and vegetables. For protein, skinless chicken or turkey, fish, lean beef, and eggs are good options. Green leafy vegetables and heart-healthy fats such as olive, peanut, or canola oil, walnuts, almonds, and flaxseed should be part of your daily meal plan. Here are some other tips for balancing your diet to stay healthy. Count carbohydrates. Carbs are found in whole grains like breads and pasta, fruits, some vegetables, dairy products, and desserts. Remember, the amount of carbohydrates that you eat will affect your blood sugar, not the type of carbohydrate. A limited amount of sweets can be part of a healthy meal plan, but they do have more calories and fat than other carbs. Read food labels. Look for foods with 3 or more grams of fiber per serving and avoid saturated and trans fats. Measure each serving. It's very easy to eat more food than you need without realizing it. A diabetes educator can show you easy ways to measure your food. Develop a meal plan. Learn portion sizes and develop meal plans that work for you.
The more I plan the meals, the better off I am. I start going off the wagon, so to speak, when I don't have the food that's ready when I'm hungry, and I tend to allow myself more than I should.
The goal of eating healthy is to regulate your blood sugar level to stay healthy. Changing your eating habits can seem overwhelming, but by working with your diabetes educator, you can start with simple goals and develop a realistic plan that works for you.
Healthy eating, one of 7 steps to a healthier you.
Hello, I'm Rhonda Hatfield, Chief Nursing Officer for CHI Memorial. On behalf of myself, all the staff here, we want to thank you for choosing our hospital for your place of healthcare. We are pleased that you and your physician have selected CHI Memorial as your healthcare provider. Our goal is to provide exceptional service for you and your family, and we want you to be completely satisfied with every aspect of your care. As the area's only faith-based healthcare system, CHI Memorial focuses on the needs of each individual person. The staff at CHI Memorial strive to provide a unique balance of patient-centered care and technological excellence to create the best possible hospital experience for you. If you have any suggestions on how we could better improve our care, please contact your nurse or our Service Excellence Department at 423-495-2772. After you leave our facility, you may receive a survey. Please help us better serve you by completing this about your experience here at CHI Memorial. We want to thank you for choosing our facility for your healthcare needs, and we wish you a speedy and healthy recovery.
Being active is an important part of managing your diabetes. It gets your heart rate up, burns calories, strengthens your muscles and bones, and may help you lose weight. And the benefits don't stop there.
Being active lowers blood sugar and cholesterol, improves blood pressure, and can lower stress and anxiety. It's so important to make regular activity a part of your daily life.
When I found out that I had diabetes, it was shocking, depressing, but soon thereafter I figured out that I really needed to find the opportunity in my difficulty.
For Lance Miller, that opportunity meant finding a healthier lifestyle, partly by eating better, but also, as he puts it, by getting moving.
You don't have to hit the gym every day. Take the stairs instead of taking the elevator. At work, instead of emailing a colleague, I'll actually get up and go to their office. When I have to park my car, I park it a little farther away so I get some extra steps in to where I'm going.
The idea of starting an exercise routine might seem overwhelming, but it doesn't have to be. No one says you have to take a spin class or jog on a treadmill if that doesn't interest you. You might prefer swimming or simply walking more.
I'm supposed to walk the dog twice a day, but now I'm walking him 3 times a day, and it's good for the both of us.
Lance says all these little changes really do add up.
Since I've been diagnosed with diabetes, I've actually dropped 40 pounds. I can go up the stairs easier. I have more stamina at work. I'm actually feeling a lot better.
Everyone's physical abilities and schedules are different. Talk with your healthcare provider to determine what's right for you. Choose things that you like to do. That way you're likely to stick with your goal of being active. Some tips? Take it slow. Start with 5 or 10 minutes of the activity and work your way up to 30 minutes at a time, 5 days a week, or more if you can. Don't overdo it. While you exercise, you should be able to talk, but not sing. Check your blood sugar levels before and after exercise to see how it affects your blood sugar levels. Keep track of your activity, which will help you feel good about yourself. Find a friend to exercise with to keep each other going. Take a class, perhaps something you've always wanted to try, such as yoga, salsa dancing, or tennis. Join an adult league and play a sport you enjoy. Mix it up. Try a few different things so you don't get bored.
The most important thing is to commit to a realistic plan for being active, and then stick with it. You'll feel so much better mentally and physically.
Being active, one of 7 steps to a healthier you. Like many people with diabetes, you may need to take insulin or other medications to help keep your blood sugar or glucose level steady. But depending on your individual needs, your healthcare provider might also prescribe aspirin, blood pressure medication, or cholesterol-lowering medicines to reduce your risk of other complications and to help you feel better.
Every medication will come with instructions, when and how to take them, and it may take a while for your body to adjust to them. You'll want to notice any changes that you may experience after starting a new medication and let your healthcare team know about any side effects.
It's a whole change of your life.
Rhonda Cruz lost her dad to diabetes when he was only 32, but she was sure that wasn't going to happen to her. So when she was diagnosed a few years ago, she didn't want to believe it.
I don't like to take medication, so it was like, oh, I'll take it when I want to.
Rhonda now sees a diabetes educator who helps her keep track of her medications and figure out how to make them a priority in a life busy with work and family.
You have to take it on a regular basis, and at the same time, if you want your numbers to be good and you want to live longer, it's something that you have to change in your lifestyle.
Dan Diliberti's lifestyle changed 20 years ago when he was diagnosed. Medications are now part of his daily routine.
I have 2 medications, one oral medication and one injection that helps my body deal with sugar in the blood and actually digest it better.
There's also a daily pill to help lower his cholesterol, and everything must be taken on schedule.
So it's just a matter of keeping track of things and looking out. In some respects, it's good because you're monitoring your body and you're more in touch with things.
A few tips on medications. Don't forget to take your medication at the right time every day. It might help if you time your medications to other daily activities, such as brushing your teeth, or set an alarm to remind you. Rotate your sites. If you inject insulin, be sure to rotate the sites every day, or your skin could develop lumps, making it harder for your body to absorb the insulin. Use the fattier parts of your upper arm, your outer thighs, buttocks, or abdomen. Get help with medication management. Ask your healthcare team why these medications are recommended, if there are any side effects, and what to do if you experience them. Keep a notebook with the name of each medicine, what it's for, how and when to take it. Talk to a diabetes educator for tips on how to fit medications into your daily routine.
Make sure to tell your healthcare provider and pharmacist about all the medications you're taking, including medications you buy over the counter, dietary supplements, vitamins, and herbal medications. These medicines may affect or change the way your prescription medications work.
Taking medication, one of 7 steps to a healthier you.
Diabesity is the combination of obesity and type 2 diabetes. Now it's called a new world epidemic. The reason for that is because the numbers are staggering. We see more obesity and also more type 2 diabetes. For patients that already have severe obesity and have a type 2 diabetes, metabolic surgery becomes the best treatment option for them. It's easier for patients to deal with the surgery. Recuperation is faster. They can go back to normal activities within a few days. Surgery enables them to not only control their weight, but also their diabetes. Sometimes the people are taking medications and they completely go off medications. Come to one of our free seminars. We have free seminars every month, and those seminars will give you information about the treatment options.
For more information, visit ChattanoogaBariatrics.com.
You're watching CHI Memorial Health Network, a service of CHI Memorial and the Wellness Network.
When you have diabetes, you learn to plan your eating, your daily activity, your life, so that your blood sugar levels stay on target. Not too high, not too low. But unexpected things happen, no matter how well we plan. So learning to problem solve and quickly adapt is key.
Life has a way of throwing us curveballs. Sometimes things just happen that can drive your blood sugar in the wrong direction. Part of managing this disease is knowing not only how to respond in the moment, but also thinking about what you can do to prevent it from happening again. Problem solve.
Gilberto Vaquero was excited to be starting his last year in college 2 years ago when he found himself in the hospital facing a life-changing diagnosis: diabetes.
It was just almost too much to handle.
From a carefree college student whose diet often consisted of beer and pizza, Gilberto admits he didn't handle the news well.
So it did prove significantly difficult in the coming months to kind of completely change my current lifestyle that I had freshman through junior year to now this completely different thing that I had to manage to stay alive.
Gilberto now exercises at least 5 times a week, and since being diagnosed, he's become quite smart about living with diabetes.
Being prepared has become a big part of my life.
That lesson was driven home by a trip he took after college.
When I went to Europe, I was actually in Paris, and out of nowhere, it wasn't a violent mugging or anything, but next thing I know, my backpack's gone, which included my medicine, which is super important for me to stay alive. It definitely opened my eyes to just kind of being prepared for any situation, whether it's small things like I have medicine at work that I keep just in case I forget my medicine.
He always has some candy available too,
because that's the quicker way to ingest sugar if my sugar ever does happen to get a little low.
If your blood sugar levels are too low, you'll need glucose or sugar right away. This could include taking glucose tablets or a tablespoon of sugar, corn syrup, or honey, drinking some juice or regular soda, or eating raisins, hard candies, or gumdrops. Your diabetes educator or healthcare provider can help you figure out what and how much is best for you. Also, your diabetes needs may change over time, so be prepared to make adjustments if previous solutions no longer work. Diabetes educators can help problem solve, in general and for specific issues you may be facing. Here are some tips. Don't beat yourself up. Managing your diabetes doesn't mean being perfect. If you encounter a problem, solve it and learn from it. Analyze your day. Think about what was different. Were you more stressed than usual? Were you traveling? Were you sick? Did something change in your routine? Were you more or less active than usual? Did you eat more carbohydrates than normal? Was your diabetes medication off? Learn from it. Figure out how to correct the problem in the future. Limit your alcohol consumption because it affects your blood sugar and can interact with your medications. If you have a drink, don't do so on an empty stomach. Consider how you can add more activity into your day. Think of ways to ease stress, such as meditating, doing yoga, or sitting quietly for a few minutes with a cup of tea or a good book.
If there are changes with your diabetes educator, healthcare team, or diabetes support group can help you find the plan that's most comfortable for you to meet your needs.
Problem solving, one of 7 steps to a healthier you. Diabetes can come with serious complications: heart attack, stroke, kidney or nerve damage, and loss of vision. So one important part of managing your diabetes is to reduce your risks.
Working with a diabetes educator to help support you eating healthy, staying active, monitoring your blood sugar, taking medication, and finding healthy ways to cope and problem solve can help you reduce the risks of diabetes complications.
Bethany Moranowitz has lived with diabetes for years, so many aspects of managing the disease, such as checking her blood sugar, are just part of everyday life.
Checking your blood sugar regularly and writing it down and communicating to your doctor about that really helps with kind of developing a sense of what my lifestyle does to my blood sugar and how I need to change things if need be.
Bethany is so in tune with her body that she knows exercise, even the type of exercise she does, can make a difference.
Running will drop my blood sugar quite a bit more than maybe walking or doing yoga. So it's good for me to develop patterns in when I exercise and making sure I check myself before and afterwards, and then noticing how different exercises can affect my blood sugar differently.
Reducing risks also means regular medical tests and checkups for Bethany, including the eye doctor and the dentist.
And then making sure just at home that I'm doing self-care for my feet. Important as a diabetic to check your feet regularly to make sure you have good sensation and you're not missing any kind of sores or cuts or anything like that.
There are several things you can do to help reduce your risks and avoid other health problems. Don't smoke. People with diabetes who smoke are 3 times more likely to die of heart disease or stroke than those who don't. Smoking raises your blood sugar and weakens your body's ability to respond to insulin. Besides harming your lungs and heart, it can make vision problems develop faster too. See your doctor regularly. Your doctor will want to see you about every 3 months to check your weight, blood pressure, feet, and eyes. You might have tests to check your kidneys, cholesterol, and average blood sugar levels. Keep a record of each test and know what your targets are. Be sure to get a flu shot every year, too. Visit the eye doctor at least once a year. Make sure the exam includes dilating your pupils. See your dentist every 6 months. Diabetes puts you at a higher risk of cavities and gum disease. And don't forget to brush and floss regularly. Keep your feet dry and clean. Wear comfortable shoes and check your feet every day. Diabetes damages your nerves, so you might not be able to feel it if you have a sore. If you find anything, let your healthcare provider know right away.
Be aware that more than half of the people with diabetes can suffer from sleep apnea. If you snore loudly or feel sluggish during the day, you may have sleep apnea. Ask your diabetes educator to screen you.
The bottom line is you have to know your body and your diabetes in order to keep yourself healthy.
If there was a cure someday, it would be strange for me to be able to let go of all these little responsibilities that I have.
Reducing risks, one of 7 steps to a healthier you.
Diabetes comes with a lot of different emotions: guilt, frustration, anger, resentment, and depression. If you have diabetes, you are at an increased risk of developing depression, and depression can make managing your diabetes more difficult. Follow this checklist to help identify depression and get the treatment you need before it affects the day-to-day management of your diabetes and your overall health. Do talk to your healthcare provider about ways to handle the stress of managing your diabetes and your life. Do get help if you experience any of these symptoms nearly every day for at least 2 weeks. Feelings of sadness or emptiness, poor concentration, irritability, sleeping too little or too much, an increase or decrease in appetite, fatigue, not caring about your appearance or things you used to care about and enjoy, or obsessive thoughts about death and dying. Do follow your healthcare provider's instructions on a treatment plan. Do take all of your medications exactly as prescribed. Do make healthy food choices, get regular physical activity, and get a good night's sleep every night. These actions can go a long way to managing both your diabetes and depression. Do not ignore any of your symptoms. Some people, especially men, might not want to admit that they need help. Do not assume your depression will go away on its own. Depression is a serious illness that often goes untreated. There are many causes of depression and a variety of treatment options, so don't be afraid to get the help you need. If you think you may be depressed, meet with your healthcare provider to find the best treatment options for you.
When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should to regulate your blood sugar or glucose levels. Since blood sugar is your main source of fuel, it's critical to check it regularly to avoid problems with your eyes, kidneys, heart, and feet.
Keeping your blood sugar within range is important. Knowing your blood sugar is helpful in deciding what to eat and how to be active so your body can perform at its best. With regular monitoring, you can quickly find out if your blood sugar is too high or too low and get it back on track.
I'll just set out my meter at my spot at the table just to remind me, like, yes, I'm going to check my blood sugar before I eat.
Being a working mom with young kids and a person with diabetes, Bethany Moranowitz says checking her blood sugar levels several times a day can be a challenge, but she's learned some simple tricks to remind her.
My purse is kind of my go-to. That's kind of where my testing supplies always are, so that I know if I'm heading out the door, I always have it with me. Enough test strips, my meter, my poker for my finger, and then I also always carry juice box with me in case of a low blood sugar to bring that level back up.
Bethany also monitors everything she eats, reading nutrition labels and measuring her portion sizes.
Kind of making sure I'm getting all the food groups at a meal, and that's going to kind of keep your my blood sugar more steady, making sure my meals are balanced.
Dan Diliberti, who's had diabetes for 20 years, has a few tips of his own, including monitoring himself when he's stressed.
I do meditation and breathing exercises to kind of calm me down. I go for walks when it happens. It really helps me a lot when I just walk it out. And that brings my sugar level down too.
Your healthcare provider will determine how often you need to check your blood sugar. This will depend on the type of diabetes you have and the medications, pills, or insulin that you take. You may need to monitor only a few times a week or as often as 3 to 7 times a day. Your diabetes educator can help with monitoring, teaching you how to use the glucometer, when to check your blood sugar, what the numbers mean, and what to do if they're off target, and how to record your results and keep track over time. It's normal for your blood sugar levels to go up and down during the day, depending on how recently you've eaten and how active you are. Remember, it takes 2 hours after eating for monitoring to reflect your true blood sugar level. Monitoring is not your responsibility alone. Your healthcare team also should do regular exams for long-term blood sugar control, heart health, blood pressure, weight, and cholesterol levels, kidney health through urine and blood testing, eye health, and foot health and sensory testing.
The more information you have, the better off you are. So I do go to the doctor regularly. I have a foot doctor that checks my feet because you lose feeling in your feet. I get eye exams. You can have damage to your retinas from diabetes. Anything that's nerve related can be affected. Your hearing, I get regular hearing tests.
It will take a little while for you to know how your sugars will change from food and daily activity. With careful monitoring, you can learn to make adjustments and manage your diabetes so that you can stay healthy.
Monitoring, one of 7 steps to a healthier you.